With me now, John Rother, who is Executive Vice President of Policy and Strategy with AARP. Tim Phillips, President of Americans for Prosperity Foundation, here with me in the studio. And Cece Conley, healthcare reporter for The Washington Post. Welcome to all of you.
Thank you.
Tim, I'd like to start with you.
Sure.
I took a look at your web page. And I know your group has been encouraging people to attend town halls.
Sure.
I didn't see much with regard to direction. In fact, what I really saw were unfiltered blogs.
We're urging folks to turn out because their very health care is at stake, and seniors have every right to especially be worried about what this plan is going to do to them. So we do urge them to turn out. We do emails out, we do phone calls, and folks who come to our website.
How do you filter the truth from the fact? Because certainly blogs are going to represent one side, and if people are looking for direction's the one thing I didn't see on your website.
Our website and the sister websites also have details on what this Obamacare does. And we lay that out for them, but we don't tell them what to do. I mean, they're good American
I didn't see it laid out. And I looked at a couple of states. I didn't see anything like that. I saw a lot of blogs and a call for action.
I think a lot of our members know exactly what's going on. They follow. They're pretty smart folks. They watch cable news, just like this, I'm sure, and they know what's going on. They know that when you hear terms like reining in cost, it means rationing. They know that kind of stuff.
Well,
you don't have to give them a lot of direction.
I have to tell you, I think it's a little disingenuous because I didn't see a lot of details. But
it's
John,
disingenuous to ask folks to turn out and defend their health care?
No, it's disingenuous to say you're giving direction when, in fact, there isn't any direction. And John, I want to talk to you because I'm going to diametrically put your site up against Tim's. There's a myth and truth segment on the AARP website. You're looking at this a little differently.
Well, this is a really important debate for people to be engaged in, and we feel very strongly that we need to separate out what's true and what's complete exaggeration, or in many cases, fabrications.
And what do you think are the exaggerations at this point?
Well, I think really there are efforts to mislead the public. I think that we would have a much better and more useful debate if we focused on the real issues involved in health reform. And there are many real issues that deserve to be debated, but not ones about government takeover or euthanasia. Those are simply not true.
So I'm going to bring in Cece for a second. Cece, we've been talking a lot over the weekend about death panels and rationing and euthanasia. We have, as journalists, you and I, it seems to me there's a bar that's pretty darn low right now that is incumbent upon us to raise.
Yes, and I hope that we are able to. We're certainly trying here with our coverage. We wrote over the weekend at some length about what exactly are the proposals that would affect Medicare beneficiaries in this legislation so far. And what you see are a mixture, but there are certainly some things that should be pretty attractive to senior citizens. Some big discounts on their prescription drugs, for instance. Some changes about waiving any kind of co-payments on preventive services. A pay raise for primary care doctors, which should improve access to those doctors. Now, there are also some changes that could mean squeezing down on payments to hospitals and some specialists. We can't predict exactly what that will mean. The people that wrote the legislation say there's enough fat in the system that we can squeeze that down a bit. That's more of a question mark. But sort of this death panel conversation really is sort of a sideshow, I think, from a very serious debate that we ought to be having right now.
Well, one of the areas that's clearly of concern is for our seniors. And there's a Gallup poll out this morning looked at how people over the age of 60 are looking at this. Only 20% of people over the age of 60 think there will be much improvement. In fact, 39% of people over the age of 65 think their lives will get worse. John, what are you hearing when you talk to your membership, which includes 40 million people?
Well, we say two things. First of all, the status quo is unsustainable. Health costs have doubled in the last 8 years. So that is something that needs to be changed. Secondly, there are no changes to Medicare benefits that are cuts in this bill. There are restraints on provider payments, but nothing that should affect beneficiaries. And thirdly, as Cece just said, there are important improvements, most notably an improvement in the so-called donut hole that will dramatically lower costs for seniors. seniors who have high drug costs. So we think on whole the bill will be a positive for seniors.
Tim, on that note, that it could be a positive. I mean, on the fact you're a smart guy. I mean, the fact that you
Thank
hear.
you for that, by the way.
Well, I'm giving you the benefit of the doubt until you prove me wrong.
That.
So the fact that you know there aren't death squads. I mean, you know that. The fact that on your website you refer to David Axelrod as a henchman.
Absolutely, he is. He's a political henchman. You bet he is. Oh, and the other side is not doing that. Listen, when seniors have a darn good right to be worried, they don't trust the government with their health care. And John at AARP, I'm surprised and disappointed and how far in the tank they are on this Obamacare thing, because they are.
Do you think things are okay the way they are?
70-some-odd% of Americans like their personal health coverage. Almost 80 in some of the polls that are out there, including an NBC News poll, by the way. People know their health care is not perfect. They also know they like their individual health care, and they don't trust the government to make it better. What the heck does the government make better? Not much. And they are very concerned about losing their rights and losing their ability to make their own medical decisions.
All right. You know what? I just want to remind you, before we go, that Medicare is the government.
That's right. Medicare is a program.
So the fact that people could buy into Medicare and have coverage.
It's also a $36 trillion liability. It's also not working that well.
Which needs
at
to
this
be
point.
trimmed.
And if you want to do that to the rest of the healthcare system, you're welcome to, but I don't think so.
So when you turn 65, you're not going to dip into your Medicare?
I certainly hope it'll be there. With the unfunded liability of $36 trillion, it may not be there.
$100 you'll want it.
It may not be there.
Tim Phillips, John Rother, this will continue. I appreciate you being here. And Cece, always great to see you.
Thank you.